Hello friends, I am Dr. Samina Zamindar from Zamindar's Microsurgical Eye Center, Kalyan Nagar, Bangalore. I bring greetings from my entire team for all of you. We wish you bright days ahead. Today we will be talking about a very important aspect of eye care. All those people who have been left behind, all those people who do not have access to eye care, who somehow have not yet found their eye care provider, or they are not aware that there is a treatment available for their blurred vision. So what is this? I'm talking of the burden of avoidable blindness. Did you know that world over 2.2 billion people suffer from blindness, and out of this 2.2 billion, 1 billion people who suffered from this blindness, we could have prevented it or yet to be addressed. How can we all be a part of solution and not the part of the problem? We can be a part of the solution by creating awareness about this blindness, by encouraging people to reach out for preventive eye checkups. A study conducted by Seva Foundation showed that every $1 invested in eye care gives a return on investment of $35, 35 times. And somewhere somebody will be able to see better. Their families will get proper food. The dependency which comes into a family with a blind person is unsurpassable. So what are the causes of avoidable blindness? The number one cause is uncorrected refractive errors. A child struggling to see clearly from the blackboard, not being able to study well, and failing in a class is a very common scenario. Even in today's world, the simple and easiest thing to do for this child is to arrange for an eye checkup and give him or her a pair of spectacles. This is the most commonest reason for avoidable blindness, uncorrected refractive errors. In this is included even adults suffering from refractive errors, short-sighted and long-sighted, both of them. After the age of 40, you must have seen many people squinting their eyes to look at near objects. This condition is known as presbyopia. Just a pair of glasses and their near vision is clear again. We have to remember that 1 in 3 people in this universe need spectacles, but only 1/3 of them are using spectacles right now. The remaining 2/3 struggle or somehow live seeing the world hazy. We can make a difference, and this difference can be critical if it is the driver of an automobile who cannot see clearly. Imagine the number of accidents which can be prevented on the road. So what are the other causes of avoidable blindness? In this video, I will be talking about refractive errors, cataract, corneal blindness, diabetic retinopathy, and something also about retinopathy of prematurity, a blindness which can happen at birth. As I already mentioned, refractive errors is the simplest to correct and still the commonest cause of blindness. A child being reprimanded at home for not studying well, for failing a class because of not seeing well. How much joy and happiness a pair of spectacles can bring. Second largest cause of avoidable blindness is cataract. Cataract surgery is needed and recommended now by the World Health Organization for anyone who has less than 6/12 vision. Now, about 2/3 of the population who really need cataract surgery are still not getting their cataract surgeries done. Why? This could be because of many reasons. One of them is a fear of losing sight after cataract surgery. This fear is completely baseless in the era now of modern cataract surgery, where the surgery mostly is bloodless, sutureless, and done with the most sophisticated procedure known as phacoemulsification. The chance of having an infection in an eye after cataract surgery has reduced down to 1 in 10,000 or even more. The other causes is that people believe that you should wait for cataract surgery until the cataract becomes mature. Now that is a definite myth. Again, that was actually true in the days when the cataract was removed in toto about 30 years back. But now the cataract is emulsified by a procedure known as phacoemulsification and removed through a phaco probe inserted through a 2.2 millimeter incision. So the longer you wait, your surgery actually becomes complicated. The other most common reason is, of course, accessibility and affordability for the underprivileged society. So here, awareness, education and donation for the cause can help many organizations like ours take care of the needy also, while we take care of those who can afford. The third part actually which I would like to talk is about diabetic retinopathy. Diabetes can cause blindness, and 1 out of 3 people who suffer from diabetes can develop retinopathy, a condition of retina which, if not detected and treated in advance, can lead to blindness. This condition can be detected only if a yearly thorough retinal eye examination is done for diabetics. But if that is not possible, at least look out for a screening camp where a retinal picture is taken on a fundus on phone and artificial intelligence can tell you whether further intervention is required. In India now many such screening centers are coming up, and these screening centers can also roughly guide you whether anything more needs to be done for your eyes if you are diabetic. The other common cause of blindness which can be prevented is glaucoma. So glaucoma is a condition where the optic nerve gets slowly damaged, very slowly over decades if the eye pressure is more. And remember my friends that this damage occurs in the periphery first and at the center the last. So if you wait till your central vision starts getting affected, you are already very late. We at our center encourage all family members of glaucoma patients to come for regular and routine eye checkups. And we actually conduct their consultation and investigations for glaucoma if required at subsidized rates to encourage them for these checkups. Family members of glaucoma have a higher chance of developing glaucoma as compared to the normal population. The other reasons for blindness could be corneal conditions like keratoconus, corneal degenerations, dystrophy, or post-infection corneal ulcer. Fortunately, advanced corneal surgeries are now available which can take care of this problem also. Retinopathy of prematurity. There are some unfortunate preterm babies who develop a condition known as retinopathy of prematurity, and the first 1 month after their birth is considered to be the golden period wherein which the retinopathy can be detected and treated by an expert. And if it's not done, if this 1 month period is missed, the child faces the danger of staying blind all his or her life. So my friends, I hope you understand that there is a need of awareness and there is an importance of community to take leadership here. We are looking for vision leaders in the community who are aware of these conditions and who encourage the community to come for eye checkups and recognize the importance of preserving their eyesight. Elderly people have nobody to take them for an eye checkup. How can you help? Look for family, friends or neighbors who have not done their eye checkup in the last 1 year. Encourage them or escort them to an eye doctor. This will be the best gift you can ever give them. Vision is such an important sense, and the pain of being blind can only be experienced by one who has already lost their sight. We need all your help to create awareness about all these conditions which can cause avoidable blindness. The simplest is starting with refractive errors. If you see a child or an adult struggling or squinting to see, he or she needs glasses. If a diabetic patient has not undergone a checkup for a long time, he needs to get a retina checkup. Anybody after the age of 40 years needs to get an eye pressure check to rule out glaucoma. and especially a complete investigation if you are a family member of a glaucoma patient. Friends, simple things in life can really go a long way in reducing the pain and burden of blindness. We look forward to all your support. Take very good care of yourself and start this care by taking care of your eyes first. Get your eyes checked today. Thank you. Namaskar.